Good afternoon. So welcome everyone to this Grace Birmingham Chambers of Commerce webinar on Birmingham and COVID-19 with Dr. Justin Varney, who is the Director of Public Health for Birmingham. So before we kick off the webinar, I'll do a quick welcome from the Chambers. Then Dr. Varney will speak about, he'll give a COVID-19 update. He'll be speaking about keeping COVID safe as a business, test and trace, local lockdowns, which is of course particularly good timing given the recent news, and then we'll have time towards the end for a Q&A session with Justin, followed by a quick thank you and close from myself from the Chambers. If you would like to ask any questions, please write them in the chat box, and Dr. Varney will try and answer it in the Q&A. And if you encounter any technical issues, please do let us know again in the chat box and we'll do our best to help. As a quick overview of the support that the Chamber are providing for businesses during this time, we always have #GBChamberChat every weekday between 11 and 12 on Twitter, which is an opportunity to connect with fellow local businesses, as well as member-to-member offers on our website to help you raise awareness of your online shop, delivery offer, products or services. We can support your business through our coronavirus hub on the Chamber website. This includes everything from content on employment skills through to returning to the office. We have informative webinars such as this one. Members have access to a free legal and HR helpline through their relationship manager. And we're doing a lot of lobbying and campaigning activity behind the scenes, not just on coronavirus and gaps in coronavirus support for businesses, but also on topics like Brexit, which are of course ongoing as well. We can also help you grow awareness of your business, of course, through thought leadership content on the blog platform of our website, and also on the coronavirus hub, which I previously mentioned. And if you have any news about your business, perhaps some new appointments, new contracts that are particularly exciting, please do send press releases through to our press team for potential inclusion in our Chamberlink daily e-newsletter, which goes to over 14,000 subscribers in the region every morning, or every weekday morning. A few upcoming webinars I wanted to highlight on digital plans for recovery and growth, the future of hospitality. We've got one on Brexit, cultural deals, deadlines and departures, navigating Brexit transition. And we also have Pro Solihull networking online next Thursday, but the big piece we have coming up, which is extremely exciting, is the Future Faces Annual Awards celebration. And I highly encourage anyone who can next Friday to get involved with that. So without further ado, I will stop sharing my screen and hand over to Dr. Varney, who will be speaking about COVID-19 and Birmingham. Thank you, Justin, for taking the time out of your extremely busy schedule, particularly this week, to come and speak to us.
Great, thanks, Emily, and thank you for inviting me to talk to you all today. I'm going to talk a little bit about the kind of pattern where we've been on COVID. I'll touch a little bit on testing, vaccination and inequalities, and then I'll talk about the situation that's changed over the last week, and particularly the implications for business about where we might go next. So COVID-19 first appeared in the world back in December, originally in China, and then spread quite quickly across the world, arriving in the UK in the middle of February. And we saw our first case in Birmingham about the second week of March. We saw a very rapid increase in cases then to hit our first peak in early April. We dipped down and then back up again. And then really since around kind of middle of May, cases have continued to drop. Now, as we've come out of lockdown, we've seen cases climb up again, initially quite slowly and to a kind of steady rate. And then over August, we've seen quite a rapid increase over the last 3 weeks. But I'll come back to that in a bit more detail at the end. There has been a shift in our approach in terms of testing, and now we're getting majority of testing through community testing, what's called Pillar 2, and that's through our drive-through sites, the walk-through sites, or the postal kits. And you will see that increase, certainly in Birmingham over the next couple of weeks. More sites will go live. And it really is the key part of trying to control the spread, is that people who have symptoms isolate at home with the people they live with, they get a test, and then if that test is positive, they continue to isolate for 10 days from when their symptoms started, and the people they live with isolate for 14 days from when the symptoms started. And that is really how we control the spread of this disease. It is spread by people who are infected coming into contact with other people and spreading the virus to them. Spread is really through the droplets that we cough or breathe or shout out of our mouth. And that's why the 2 meters of distance is important. Some of those droplets will land on things that we then touch. And when we touch them, they get on our hands and we touch our face. And the virus gets into our body, not through our skin, but through our eyes, our nose, and our mouth. So when you touch your face, this thing's not a mountain climber, but it can make that short transfer across your face into your eyes, your nose, your mouth, if you're touching your face with dirty hands. The face coverings are about trying to keep your germs close to you. So I've said these viruses are coughed out or shouted out or sung out of your mouth. So think of it a bit like a kind of projectile vomit coming out, and they drop down to the ground after a certain distance. So that's why that 2 meters is important. But if you've got fabric in front of your face that's covering from the middle of your nose down to under your chin, then it keeps all your germs close to your face. You've already got them, so that's not a great risk to you, but you stop giving them to someone else. And that's why it's so important that people do wear face coverings, and that businesses are encouraging people to wear face coverings where there are environments that they're coming into contact with strangers. And this is the key bit about why do we say face coverings in spaces like shops or buses, but not necessarily in offices. And that's because in a shop or a bus, it's very hard to know who else is in that environment. Whereas in a workplace, you know exactly who's arrived, what time they got there, what time they left. So if we do have a case, we can track it really easily. So that's why there is that difference in the advice between face coverings in shops and in faith settings and in spaces where people can just mix with anyone, as opposed to when you're coming into workplace and it's a very controlled environment. I'll touch a little bit about vaccination and treatment, and then I'll go on to inequalities next. So in terms of the vaccine, there are a huge number of trials across the world trying to pin down a vaccine that works. Developing a vaccine takes time, and there are basically 4 steps to vaccine trials in simple terms. The first one is, does the vaccine itself cause you harm? So if we give it to a human, is it toxic? The second is, does it create an antibody response? So do you create the right response to this? The third is that if you create an antibody response, how long does that response last? Because some vaccines we need to keep giving people repeatedly because they're not very good at just with one dose at getting your body to learn how to develop antibodies effectively. And then the fourth level is if you give it to different types of people, different ages, different ethnicities, different genders, does that make a difference in how effective it is? So vaccine trials have got to go through kind of all those stages to ensure that they are going to do what we think they do, which is give you the protection that if you're exposed to this virus, that it stops you catching it. Once we've got a vaccine that is effective and passes those 4 tests, we've got to get enough of the vaccine to roll out, and then we've got to do mass vaccination. And we haven't really done mass vaccination for the whole population ever. What we vaccinate at the moment is children as they're growing up, and we vaccinate people on a yearly basis for the flu jab, but there's only about 20% or so of the population. So it will take us, I think, 3 to 6 months to vaccinate everyone. And with a good wind and where the trials are going at the moment, we'll get a vaccine that's viable in the autumn. So we're going to be in this COVID world well into the end of the year and probably well into the beginning of next year, before vaccination really becomes a defense mechanism. in terms of treatment, we have had some progress in terms of treatments that reduce the risk of people in hospital dying, and that's really good news. But what we haven't got is a drug that kills the virus itself. So these treatments are all working to reduce the symptoms of the virus and the severity of those symptoms, but it doesn't actually kill the virus. And until we get a drug that really does kill the virus, that isn't going to be a game changer. So I'll talk now a little bit about the inequalities we've seen with COVID. Really what we've seen is that COVID's affected different parts of the population differently, and that's primarily in terms of who's caught it, being about whether you continue to go to work, whether you continue to use public transport during lockdown or not. And that's impacted on your exposure. So we've seen more people affected by COVID who, for example, work in public transport, the private transport industry, more people who work in the restaurant industry, who continue to work in takeaway functions, more people who are security guards, for example, than in people who are office workers. So that just reflects the pattern of how people were out and about during lockdown in terms of exposure. Where the inequalities are more pronounced, and I think where we can take more action, is around the inequalities in who got sickest and who is at highest risk of dying. And there are 6 key factors to keep in mind. 3 you can't do anything about, and 3 you can. So the 3 you can't change, no matter what marketing tells you, is your age, and that is the first one. So if you're over the age of 70 and you go into hospital, you have a much higher rate of chance of dying than someone who comes into hospital who's aged 20 or 30. So age is the first risk factor you can't change. The second is your ethnicity. And there is evidence that people from non-white British ethnic groups were increased chance of dying if they went into hospital. And if you are a man, that you also had a higher risk of dying or being severely unwell. So those are the 3 that you can't change. And I should just be clear to be inclusive of our trans colleagues. When I'm talking about man in this context, it's about your genetic sex rather than your gender identity. So the 3 that you can modify, and they play out to some extent in the picture we've seen linked to gender and linking to ethnicity, are 1, if you're a smoker, increases your chances of dying significantly. 2, if you are significantly overweight or obese, particularly if you have a body mass index of over 40, that increases your chances of dying or being seriously unwell. And 3 is if you have a long-term condition like diabetes, high blood pressure, chronic lung disease, or chronic kidney disease. Now, the long-term conditions bit is a bit nuanced in that there are 2 parts of it. First, having the condition increases your chances of being more unwell if you catch COVID. But the second is if your condition is poorly controlled, so for example, you're a diabetic and your sugars are all over the place, you are much more likely to be severely unwell than a diabetic whose sugars are really, really well controlled. And we know that both men are worse at the management of their long-term conditions, but also in some ethnic communities, both the number of people who have these conditions is higher, but also the way that they've been looked after by the NHS and they've interacted with those services is not as good. So the management of those conditions is not as good. So there's a real focus at the moment on what can we do with people to modify those 3 risk factors that can be improved. And we will be launching at the end of this week the Be Healthy campaign, and I'll work with Emily in the chamber to make sure those materials are available. It's a very simple checklist of things that people can do that can reduce their risks if they catch COVID or becoming severely unwell. It also includes stuff to reduce the risk of catching COVID and how to get a test. We're translating it into over 21 different languages. There'll be webinars as well. There's a whole program that we'll be rolling out. I'll now move on to the bit that I'm sure you are most interested in today, which is what's happening at the moment and where are we heading. So over the last 3 weeks in August, we've seen a gradual increase in case numbers. And what you see is a pattern where case numbers spike on a Wednesday and fall down over Friday and the weekend and then come back up again. And we've seen that pattern consistently since community testing has come into effect. I think that probably reflects that if you're testing as a postal kit and you order a kit in Birmingham on a Saturday or Sunday or a Monday, you don't actually get your kit until the best late Tuesday afternoon or usually Wednesday morning. So that's why we're getting that bulge of people testing on a Wednesday, and therefore the results spike on a Wednesday or a Thursday. Over the last 2 weeks, we saw those numbers rise really quite dramatically, and a significant increase in case numbers. And that saw our rate rise from, at the end of July, we were running about 15 cases per 100,000 to at the highest, which I think was on the 14th of August, our 7-day rolling rate went up to 30 per 100,000. Now, it has come down since then. You would expect it to do because, in effect, the numbers are moving away from the Wednesday and we're moving into a 7-day window, which is running Thursday to Tuesday. So there's that kind of process going through. So we're waiting to see, and we won't know really until probably the beginning of next week, whether this week's numbers have been higher than last week's or are coming down. And so that's why there is an increased concern at a national level and at a local level. It's why last Friday I took the decision to ask all the care homes in the city to stop visitors. I'm sure, although this is a difficult decision, was a difficult decision because of the personal impact on families that closing for visiting has, I wanted to take immediate action to protect those who are most vulnerable. I now want to avoid as far as possible the risk of coronavirus sweeping through our care homes again and seeing the same issues we had earlier in the outbreak. So that's why I took the decision. I will continue to review it on a weekly basis. We know that there's a meeting of Gold Command this morning nationally where the national watch list has been discussed and it will be published tomorrow. I expect that we will go on to that national list because of the increase in rates. And I expect that we will go on as an area of what's called enhanced support. So that's not the level that Leicester and Greater Manchester are in, it's the level below. So think Northamptonshire, Blackburn, those kind of areas are what we're looking at, certainly over the next week. And that means it's about reinforcing guidance. We'll be providing additional guidance over the weekend on some of the additional advice for people. Some of that will be about reinforcing existing messages. So we will be saying to the public, if you go to a bar or restaurant and they don't ask for your contact details, go somewhere else. Or ask them, why aren't they asking? It's part of the guidance of what good practice looks like. You know, most of the restaurants and bars in the city are doing a fantastic job of being COVID safe. I've been out enjoying some of them over the last couple of weeks, you know, and it's great to see serving staff wearing masks. It's great to see hand sanitizer at the door. It's great to see businesses managing their queues, which is a real risk space. Actually, it's not always what they do when you've got them seated. It's the queue outside the front door where they're not socially distancing. So, you know, we will be reinforcing to the public, you know, business should know what it's doing. There are plenty of guidelines now for industry specific guidance. And if you're not seeing safe practice, take your business somewhere else. You know, so that's just a kind of some of the stuff we'll be doing. We will, I think, be providing additional messaging. We're just agreeing that at the moment around advising people to reduce the numbers when they visit each other's houses. And looking at what more can we do. As many of you know, we've already been stepping up some of our education visits to businesses and just popping in while we're in the neighbourhood to find out how you are doing risk management and providing advice. For those of you who've already had cases, I have to say, you know, I've been really reassured. It's a reflection of all the work you are doing and the Chamber's been doing to support you. In terms of making sure that risk assessments and risk management's there. And in the vast majority of cases, when we see a situation where cases are identified in businesses, firstly, you're coming to us quickly with your first case or your second case. You're not waiting till you've got 10 or 12. And that's really important because it means we're able to work with businesses straight away. most businesses are not having to close, and actually we're controlling it, and we're not seeing spread in a business in the way that some other parts of the region have seen. Secondly, when Public Health England are going through their risk checklist, that actually the vast majority of businesses have got it right, and that means that we're not seeing the spread. We've had a couple where there's some tweaking to be done, but we've only had really one or two where I would say the risk assessment was just not there. You know, the vast majority of you are doing the right thing, and it's really important that I ask you as peers to kind of do that peer-to-peer pressure a bit. You know, it will only take one business to really go wrong to take down the city, frankly. You know, and that's why it's about all of us working together in this space, looking at this. When we look at the geographical spread of the escalation, it's across the whole city. You know, it's fair to say there are more cases in the east, the west, and the centre of the city than there are in the north and the south. But there are definitely cases in the north and the south. So, you know, the only places that we haven't got cases, frankly, is the Edgbaston Reservoir and the middle of Sutton Park. Everywhere else, there are cases. And testing varies across the city, and that's one of the things we're looking to do to increase testing access to try and address it. We are seeing at the moment the majority of cases are 20 to 40-year-olds. That's one of the reasons we're not seeing the rise in hospitalizations. And if you look at the pattern of what's happened in places like Florida, Spain, and Switzerland, as they saw an increase in cases coming out of lockdown, it started with 20 and 30 and 40-year-olds. About 3 weeks later, it was 50 and 60-year-olds. And about a week after that, you started to see hospital admissions rise, and then you saw deaths rise about a month after the initial spike. And that may well have been what happened here. We just weren't testing people in February to know that. So, you know, there is no evidence that the virus is less deadly. There's no evidence that it reduces. It's reduced in the way that it spreads to people. It is more that actually what we're seeing is that we've got better understanding of who's caught it earlier, and that gives us a better chance to control it. So over the next days and weeks, the ask is for business to really help us, work with us to get it right, to make sure that people are doing what they're asked to do. We are picking up with government around things like supermarkets and the national narrative of supermarkets, but it is very much down to the individual site managers as well, is our understanding of it. So we're doing what we can with national government to put some pressure on some of the chains, some of the practice there, and we will be reinforcing. You know, there are some things where unfortunately the legislation says should, not must. I'm afraid that's the decision government made, but we will be reinforcing should means should, and should is not really an optional given the state of the city at the moment. And you know, part of working with the chamber and the business networks is to help you learn from each other. There is some fantastic good practice in the city. There are some real instances where I've looked at cases in workplaces, and my initial reaction, frankly, has been, oh my God, this is going to go really pear-shaped. And then as I've read through the report, I can see that actually the business has done absolutely everything to keep this under control. What's really happened is the individuals, the staff members, when they've been having a cigarette break or gone out to lunch, that's where they've let their guard down. That's where the infection risk has happened. But because the business has managed the risk so well, it's only 2 or 3 people who've got infected, and we haven't seen the escalation that we have seen in other parts of the region. So we need to keep that up, and we need your help reinforcing these messages with your staff and with your customers. You know, we need your help to make sure that people are wearing face coverings when they're coming into shops. We need your help to make sure that they are giving their details when they come into restaurants and pubs, that when they are queuing, that you're managing the queue as well as managing inside of the store, because those are the kind of risk factors that we're learning from places like Leicester and Greater Manchester have really driven the numbers up. If we do see the numbers going up, then we're likely to see the issue of what would a further lockdown look like. And you know, that's the kind of scenario you've got in Leicester and Greater Manchester. that's the position where you start to see enforced restrictions on travel, enforced restrictions on non-essential businesses closing. That will be shaped by the data. And what we understand over the coming week in terms of if the numbers continue to climb. As I've said, at the moment, the picture in Birmingham is kind of split between family gatherings, socialization, and workplaces, and it's kind of half of one, half of the other. Whereas in some of the other parts of the country, it's been much tighter focus. The final thing I would just say is we have really been pushing with government already over this week about the need for a better financial support package around if we do move into further lockdown, and also about the impact on individuals who have to go into isolation because of a positive test or contact with a positive test, and that statutory sick pay is not really the best answer. So we are lobbying on that, and the politicians are heavily involved, and we are getting support from the Mayor of the Combined Authority in that space as well, because we don't want to be a city that sinks because we haven't thought about the economic impacts of isolation, both on individuals, but also that impact on the business. And Paul Faulkner and the Chamber are working with us on that to lobby hard, because it is something we're very conscious of in terms of this. So I'll finish there, Emily. I've covered quite a lot, but I'm happy to pick up with you some of the questions that are coming through.
Brilliant, thank you. I think that was a lot of information. It was really helpful. I've picked up a couple of questions from the chat, but first I did collate beforehand a few questions that we've been hearing repeatedly from our members. So as you can imagine, particularly given the nature of what we do, business meetings, should they be going ahead in person, or is this something that right now it's not the time for?
Yeah, so my advice is if you can do something from home or virtually like we're doing this, do it virtually. We need to be cautious, and I know that has implications for high street retail. I'm very conscious that that the city centre where I live in Birmingham is much quieter than it would be normally during the week. I just have to look out of my window over the mailbox to see how quiet things are, and I understand the impact that has on hospitality and retail, but we are at that kind of knife edge moment. So my advice is, if you can do it virtually, do it virtually, and really support people to support their local economies. There are a lot of us that do live in the city centre who can support businesses in the meantime, but we need to be more cautious, I think. And I certainly wouldn't be planning any large-scale events over the next month or two. The picture is likely to continue to evolve. And we are likely to see a world in which we see these spikes and we go into this kind of situation for 2 or 3 weeks, we come out of it again, then we might go back into it again. So it will be this world of kind of in and out, I'm afraid, until we get vaccination.
Yeah, so it sounds like that would be sort of the similar advice in regards to, business meetups, AGMs, that sort of thing. What about job interviews? I know sort of obviously right now we're all very conscious of the impact of unemployment and obviously as the furlough scheme winds down, the potential for that to increase. Obviously job interviews involve more people than just those you employ coming in and out of an office. Is there any official guidance on that?
So I've not seen any official guidance. I've seen lots of good practice, and in my own part of the council, we're currently in the process of appointing 31 people to support the test and trace response. So I'm getting quite good at digital virtual interviewing of people. And there's some really clever examples going on of people using the digital interview space to be able to set people timed tests, for example. But also I would say, now you want to know how someone interacts through these mediums. You do want to have confidence that your staff can work in this kind of environment and work digitally and virtually. And what better way of testing it than at the interview? It's not the same. You don't get to shake the hand. You don't get to pour them a glass of water. but actually you have got a great ability to kind of see how a person does interact using this, and I think we are seeing most businesses are finding that it's relatively easy to adapt interviews in this way. It also means you can see candidates much more easily because you don't have to take into account travel time and all of that, so it's more cost effective for many people.
No, it's a very good point about digital skills as well. So there was comment earlier on when you were speaking about face coverings from a college about whether they should be encouraging students who will be on site, so up to 2,000 students in any one day, whether they should be encouraging them to wear face coverings while on site.
Yeah, so what I would say, I mean, certainly if you're in Birmingham footprint, please talk to our education and skills department. We're trying to make sure we're giving consistent advice to all of our education settings, and that includes higher education. Certainly the advice we've given our universities, and I think this would apply to sixth form colleges where you're working with older children, is face coverings inside buildings. It's just easier to have a one size fits all. Rather than kind of go, well, you wear them in the corridors and then you take them off when you're in the classroom. You might as well just put it on. It also stops the fidgeting and the pulling it on and off, and that is a risk. If people don't wash their hands before they touch their face covering, what they do is they touch the face covering, and round the edges they smear all the germs on their hand on their face, and all they've done is infected themselves. And that's the reason we don't recommend face coverings on younger children, because they do fidget with them too much. People can, if they fit the exemption criteria, which is quite specific, you can download a badge from the Department of Health website for free. And that can also be done as an image that goes on your phone as well as a print off. So enforcement does take that into account, and it's very simple. You just flash your badge. That's not particularly different from having a disabled car sticker. And I think we need to be honest about that the vast majority of the population should be wearing face coverings when they're out and in a house they don't live in. There's a very small number of people who are truly exempt. Fine, let's respect that, but also respect that the fact we're wearing face coverings is about protecting them, and some of them are incredibly vulnerable. So we have to take responsibility of wearing a face covering because some other people can't, and it's our job to play our bit in protecting them as well.
That's an excellent point, and I think it sort of links into what you're saying about vaccinations and the importance of finding a vaccine, not necessarily so that everyone can have it, but for those who can have it, to protect those who can't. So we've had a few questions about testing. So you mentioned test and trace. There's one question in the chat about the reliability of home testing.
Yeah, so what I would say, there are two different types of tests. So there's what's called an antigen test, which is the swab that goes up the back of your nose or the back of your throat. That's looking at, have you got it now? And that's pretty reliable, providing you push the swab far enough. And there are a whole load of videos from the NHS now on how to do it. We're seeing certainly the number that are incorrectly done is falling. If you go to one of the drive-through sites, then often it will be nurse that does it for you. If it's a walk-through site, then you do it yourself, but there is someone on site who can help and give you advice. And we're seeing generally people, that's not a major number of people that aren't doing it correctly. Every test has got a false negative and a false positive, but they're very small for those tests. The tests that are a bit more problematic are the antibody tests. And the reason for this is a couple of things. So firstly, about a third of people who definitely have had COVID don't develop antibodies. And this is because the virus is part of the common cold family, and our bodies are just not very good at building those special response troops to fight back this virus. And the second is that of the people that do develop antibodies, about a third of them forget how to do it quite quickly. So if you do the antibody test at the wrong time, the body's forgotten and it hasn't got them anymore. And we just don't know that if the person still gets exposed to the virus, where the body will suddenly go, oh yeah, I do know how to protect myself, and starts producing them, or it's completely forgotten and it doesn't have a clue. And that evidence is still emerging. So, and then the third element is that the antibody test has to be a blood test. And if you're taking it at home and you're squeezing the blood out the end of your finger, there is some concern that the test is not as accurate. And also because then the sample bottle sits around, etc. So there's more work being done. And my advice at the moment is, bluntly, don't waste your money on antibody tests. Antibody testing is really being done for research purposes. It makes no difference on social distancing, no difference on face coverings or hand washing. It's purely for academic interest. So there are better ways to spend your money on some more hand sanitizers and face masks, frankly.
That's really useful advice. The other question we had about testing in the chat was that some financial services and life insurance firms are now asking new customers if they've received a positive COVID test, and then premiums then appearing to be raised for products due to uncertainty on how COVID affects people long term. Do you think that is going to affect the statistics and whether people potentially are reluctant to take the tests and just to isolate without doing so?
Yeah, I mean, it's interesting. That's the first time I've heard that. And JC, I'd be really grateful if you could email perhaps through Emily to me a bit more details, because it'd be good to see some very specific examples of that, and then I can raise it nationally. I mean, it is worth saying COVID-19, excuse my language, is a bugger of a disease. It behaves quite differently in some ways to normal seasonal flu or influenza. It causes problems for people with clotting. We're seeing increasingly that people some people have this long-term kind of viral fatigue type syndrome that we've seen with some other viral conditions. So there are concerns that there is a kind of group of people, and it is a relatively small proportion, where catching COVID has much longer term impacts. But for the vast majority of people, that's not true. And actually the vast majority have it and they get better and they're fine. But it would be useful to get those kind of more specific examples, perhaps through you, Emily, because I'll pick it up nationally to kind of raise that as concern, because it's the first time I've heard of it.
Yeah, that's definitely something I'm more than happy to pick up following this and send that information across to you. I thank you again to JC for flagging it. There are a couple of, obviously you've touched on whether we might have a local lockdown, what it might look like. There are a couple of questions about local lockdowns. Firstly, whether individual constituencies or wards should be locked down rather than the whole city. Then also whether if there's a lockdown or restrictions put in place in Birmingham, how might that affect staff that live outside of Birmingham and commute in for work?
Yeah, so I mean, there are lots of ifs and buts about this and what may or may not happen. And as I said, it will depend on what happens with the data over the next week to 10 days. If we see this really geographically clustering in a particular part of the city, then we might have a different approach. If it continues with the broader everybody, then in all parts of the city, then we'll be looking at the whole city. We're likely to see a kind of phasing approach, that the initial advice will be probably along the lines of avoid travelling in or out of the city if you don't need to, for non-essential, but that won't be something necessarily that will restrict. If that moves forward, we still see numbers continuing to escalate, then we might move to an enforcement model. And the key bit will be that language of essential travel. Your work is essential, but it's a question for businesses about how essential. And that comes back to my previous point, Emily, about meetings and stuff, is, my advice at the moment is, if you don't need to do it face-to-face, don't do it face-to-face. Why take the risk? It's more cost effective for people's time, and actually it's more effective in terms of reducing the risk of spread of the virus. So if you can do it remotely, keep doing it remotely, certainly over the next couple of weeks while the picture becomes clearer. And it depends. If we see numbers rise, we will have to look at travel restrictions. We are also working with our neighbours So I've been briefing with my counterparts across the region. We've been talking to the combined authority, the mayor. I met this morning with the leader of Birmingham and all of the other leaders for the metropolitan authorities as well, and the chief execs group yesterday. And all of us are looking at, well, what happens if Birmingham goes and the others don't? We're also watching carefully as numbers have been rising and fluctuating in areas like Sandwell. And there is some increase in some bits of Solihull on the border as well. We've had increases on the border with Worcestershire and Warwickshire. So, you know, it is a regional picture at the moment that the whole region is a little bit nervous. And we're just, you know, we're all upping the ante a bit because, you know, what happens in Birmingham does affect the rest of the region, but similarly, what happens in the rest of the region does affect us. So we really are working together on that. But it's too early to be able to say definitively, this is where the line's going to be drawn, because it will depend on what the data picture emerges over the next 5 to 10 days, really.
I think I would imagine it similarly is dependent on what the data says and data that you don't have at the moment and can't possibly have about how this develops. But do you have any idea of timelines, I suppose, on how long a local lockdown might be? And equally, there's a comment that's just come up. If we go onto the government's watch list, what are the chances of that restriction being stepped up before the bank holiday, where not only will people have travel and social plans, but actually the implications for businesses of that could be quite significant?
Yeah, and you know, one of the advantages I think of where we are at the moment is the journey, you know, working with government over the last 48 hours as the preparations for the Gold Command meeting today and the announcement tomorrow. We're given much more headspace about what might happen, which means I'm able to talk to you about it. Now, I can't say, you know, 100% is this or that, because the decision is still being made by government, but I can give you a pretty clear sense of the direction. And we're fortunate because Leicester didn't have that. The data flow wasn't good enough. So I think we you know, my hope is we will get at least 3 to 4 days run-in where we know the direction of travel, and we can start to work with the chamber to make sure businesses are aware and start to work with the public to prepare them. You know, I'm hoping we don't get a decision on a Saturday night, you know, or the day, you know, Friday before bank holiday Monday. But it depends on what we all do over the next week, basically. I mean, you know, bluntly, Birmingham's got to stand up and stand together on this. What we do over the next 7 days will decide whether we go into lockdown or we don't. If we all step up, get those risk assessments in place, really push that crowd management, the queue management, the hand washing, the face coverings, all those simple things, but they do make a difference, then we can avoid it, or at least defer it for longer, which is, you know, what we're aiming to do. You know, so I think that's the kind of approach. I think if you look at how long it's going to last, I think Leicester are running at 3 to 4 weeks now. You know, Blackburn, GM, I think, is coming up to its 3rd week. I think it would be unlikely for that window to be less than 3 weeks, because that's what the kind of approach is. And that's how long it takes for the impact to be seen in the data. So you think you're really looking at a minimum of 2 to 3 weeks if we do get to that restriction lockdown phase. And that's why it's really important we take action now, because I know that's going to be devastating for business. Let's be blunt about it. You know, the last thing our hospitality sector needs, our retail sector needs, is 3 weeks of people not shopping and spending money. So it's what we do now to act responsibly, to own the management of those queues, to keep the space, to keep the registers in the pubs. You know, everything we do over the next 7 to 10 days buys us time to avoid that kind of restrictive lockdown, because it will be devastating, not just in terms of the impact of this disease on people's lives and their health, but potentially on their livelihood and the economy of the city.
No, I think that warning is something that people are really heeding after the data that's come out in the last few days. Going back to, we've had a couple more questions on potential vaccines. I know we've spoken in the past, unrelated to COVID, in a bizarre world pre-COVID, about the importance of widespread vaccination, and there's been quite a bit in the news recently about whether people would want to take if one was made available. How important in this is widespread vaccination going to be to get through the pandemic? But also, we've got another question on vaccines which sort of links in. If your body forgets how to fight the virus, how will the vaccine, and I say this in a broad sense of there is no current vaccine, but in your opinion, how will the vaccine be different and have that lasting effect?
Sure. So we can't force people to have vaccinations. We don't generally. We are a democratic society. If I give you a vaccine against your consent as a doctor, it's considered battery and assault, and there's case law that proves that. So we will, but frankly, why wouldn't you vaccinate for a disease like this? There will always be a small proportion of people who ideologically object, but I think the majority of the population will be queuing up, hopefully in a socially distanced way, to get their vaccine. That the question about how come the vaccine will teach our body to remember is exactly my point about the trials that are going on at the moment. So one of the things that's being looked at very carefully is this a vaccine we're going to need to give people 3 doses of? So if you think of something like the measles and mumps and rubella vaccine, we give that 3 times to give people lifetime protection. If you think of something like the annual flu vaccine, we give it on an annual basis, and that's because the flu virus keeps changing enough that the previous one's not quite correct. Now, we're not seeing that level of change in COVID-19 at the moment, so our hope is that it's more of the kind of version 1. Some vaccines take 1 jab, some vaccines take 2, some vaccines take 3. Some vaccines you need to keep giving people boosters at various stages, and that's exactly what the level of trials that we're really at now is looking at, is how many times do you need to give this vaccine for the body to really learn how to protect itself, and also what's the kind of rate of failure. So if you look at something like hepatitis B vaccine, there is a small proportion of people, doesn't matter how many times you give them the vaccine, their body just can't learn how to do this. So we need to understand that as well, because if that's a very large proportion of people, then we need a different vaccine. So that's exactly why it's taking so long to get a vaccine right for this disease. It's not an easy journey, but it is one that's being done to try and get the best and most effective approach.
Really helpful, thank you. We have time for a few more questions before we finish the session. One that I think has come up in a lot of discussions that I've had recently is obviously a lot of people working from home are anxiously awaiting the reopening of schools. What impact, I mean, you talked about sort of different levels of potential local lockdown, but what impact might that have on whether schools reopen or not, and measures that might be undertaken in schools to make sure that the vaccine isn't spreading between students?
Yes, although I don't have children myself, many of my staff do, and I spend quite a lot of my Zoom calls and Teams calls with small children joining us over the last couple of months, and I absolutely understand, and in a really blunt way, how hard this has been for many people. It's a completely different scenario when you've got looking after your children at the weekend, when you haven't got to do work, and trying to balance a full diary of meetings and look after your children is a massive ask, particularly for single parents. The reopening of schools themselves is relatively low risk. In Birmingham, we've had about 80% of schools open throughout the outbreak, looking after key worker children and those children who are most vulnerable. And although we've seen cases of infection in children and in teachers, what we've not seen is that lead to an outbreak. And our schools have been doing a great job doing their risk management. It's about a 48-page document, the risk management tool we developed with schools and with teachers' trade unions on board as well, to make sure the teaching environment was safe for children and for staff as well. So the evidence shows internationally that children are not great at spreading it, particularly small children. And also when children do catch it, it's relatively unusual for them to have severe disease. So very, very small number of children in hospital across the UK throughout this. And so the risk to children is small. The risk of them spreading it is relatively small. The key risk around schools is actually the school gates. It's the parents having a chat while they're waiting. It's that kind of socialization. And there is advice going out from schools to parents about what else they can do. You know, kids will wash their hands before they leave, but getting them to wash their hands when they get in, using hand sanitizer when they get in the car, those kind of things will help reduce the risk as well to them bringing it into the home, particularly if they live in a house with granny and granddad or someone who's got a long-term health condition as well. So, you know, that schools, I think, probably will proceed with opening, but it will be a different approach, you know, because of the spacing they need and the risk assessment. It's not going to feel like a normal autumn term, and not all children will go in every day. And every school's doing it differently because they've all got different buildings. So if you're a parent, your school should be talking to you already about what the plans are. Universities and sixth form colleges, slightly different. Older children behave more like adults. And again, the risk is not from when they're in the classroom or the lecture theatre. The risk is when they're socialising. So it's a bit like the rest of us at work. We're very good when we're doing our job. We forget when we go and hang out with our mates. And that's really the risk, and it's what the universities particularly are doing strong messaging on with students before they arrive is, you know, it's Freshers Week is not going to be the same this year in Birmingham. And we've got to be responsible about that. It's also why we've got to be responsible in the spaces that students socialise, like bars and pubs, and really make sure that they are sticking to their household units and they are sticking to that distancing when they are meeting up with friends, and that we're keeping a register of who's coming in. Because the real risk for us is not what they do in school, what they do in education. The risk is what they do outside.
Thank you. I think that's probably pushed some concerns of a lot of people. Just in the few final minutes we've got left, do you have any sort of final advice for businesses on how to be as safe as possible? Are there any sort of more examples you could give of best practice, or perhaps, you know, can you reference some areas that maybe you're seeing are sometimes overlooked, just so that businesses watching and listening can make sure that they're not overlooking those areas?
Yeah, sure. So what I would say is in most of your sectors, there is kind of professional standards or sector standards that you can reference that take you even further than the national guidelines. But more and more, actually, the national guidelines are getting much better and much more detailed and specific. So my advice is, where the national guidance said something you should do, please don't view it as an optional, just do it. You know, we are too risky a city of our size and on our scale to kind of view the should things as optionals. Just view them as this is what you need to do, rather than something you should consider. Because I think that will keep us all safer. And you know, I know that has economic impacts, but it's a lesser impact than closing down the city. So please keep that in mind. I think the other advice I would say is keep your staff on board. Keep them cited on what's going on. And you know, I come from the NHS in my background, so I'm used to very heavily trade unionised business, and the trade unionists kind of banging on so that staff know what's going on, etc. And I recognise many businesses that's not the same. So it's really up to you as business leaders to talk to your staff, to talk them through what you're doing to keep them safe and to keep the business safe. And to really kind of make them aware of why it's important. Where we've seen large outbreaks across the region, often that's been in a situation where employees have felt uncomfortable but didn't know how to raise it with management. So they were seeing the things that weren't quite right, the social distancing that wasn't there, the people that were huddling up when they were having their cigarette break, but they didn't know how to raise it. Now, as a council, we have set up a whistleblowing helpline. So employees can reach out to us, as can members of the public. And we do follow up on all of those inquiries. And so if you do get a call from environmental health, trading standards, or the police, we're trying to be supportive. We want to avoid enforcement if we don't need to. The way we avoid it is by everyone doing the right thing. And I have to say, the vast majority of what I've seen so far is businesses being incredibly responsible in the city. That's why we've weathered this storm so well, and we've got to keep it up. But please keep your staff on side, and where you are a customer-facing business, think about the spaces that happen just outside your front door, particularly those queues. What we're seeing in Greater Manchester at the moment is it's some of that mingling while people aren't keeping the social distancing in the queue space that has been the point of transmission. So think about your business in its totality, from the point people start to walk towards you till the point they've walked away. And everything that we do together as a city, all of us as individuals, is what's going to play out over the next 10 days to 2 weeks in terms of whether we go into lockdown or whether we weather the storm in a better way moving forward.
Thank you. I think you're perfectly on time, and that is a fantastic note to end on. So thank you ever so much, Justin, for joining us and sharing your expansive knowledge on this as the situation is emerging. And good luck with what seems like it's going to be a very long week. Thank you.